The answer, as of 4 days ago, on May 8th, as officially announced by the American Academy of Pediatrics, is yes. All children need to be coming back to their pediatrician's office for the delayed vaccines that they did not receive in the last 6-7 weeks and for their well child visits. This is very important that children be caught back up on their vaccines and return for the preventative well checkup that should have happened within the last 7 to 8 weeks. Many pediatricians' offices were closed, so this was pretty much impossible to happen. But now that by now most pediatric offices are open, we are really recommending that everyone return back for their well checkups and vaccines. We do not need another outbreak of a highly contagious infection, for example, measles, which happened just a mere few months ago because of delayed vaccination of children. It is very important that children be caught up to date on their vaccines. We understand that parents are very nervous and very scared. Because of that, pretty much every pediatrician is taking measures to ensure that the risk is basically minimal to zero. What we are doing is, in our office in Williamsburg, we make sure that every child that enters the office and their caretaker is wearing a mask before they even enter the office. They are brought into a room immediately if they're coming in for a well checkup, and that room has been cleaned thoroughly before the exam, and after they leave the room, that room will be cleaned thoroughly. Other pediatricians are scheduling specific times during the day to do well checkups. And some pediatricians are even allowing only one pediatric patient in the office at a time. They will specifically allow only one family at a time. And when that family leaves the office, they will allow the next family to come in from their car. Please discuss with your pediatrician, but it's very important to be coming in as soon as possible for your well child visit and to catch up on those missed vaccines that were not received in the last few weeks. So by now, we all know that many children have been infected with the coronavirus, and almost all children were completely without any symptoms at all. That means that they were the main primary transmitters of this disease without having any symptoms. And that's actually the main reason why we closed the schools in all of New York, because kids were transmitting this virus from one child to another, and then that child would bring the virus home and spread it to the extended family. So now, a few weeks later, when almost all children have developed this virus by now, a very select few have developed something called pediatric inflammatory multisystem syndrome, which is basically when the child reacts to that virus from a few weeks ago and is not contagious, but will develop a very high fever, usually above 103, with other system involvement, including a little bit of redness by the eyes. You can have redness around the mouth, on the lips with chapped lips, a little swelling by the lips, even a redness inside the throat, a strawberry tongue. Also, you can have lymph node swelling, a rash on the upper chest, the lower chest, even in the groin area. And it also can cause other organ involvement, including the kidneys with decreased urine output, the gastrointestinal system with vomiting, diarrhea, belly pains, and worst of all, it can have a very severe effect on the heart. This syndrome is very similar to Kawasaki disease, which we know very well, and is something we're always nervous of whenever we see a child with fever for more than 3 days, and also involves a little bit of redness in the eyes, a little bit of swelling around the mouth with dry chapped lips and a rash inside the throat and on the tongue, and also a rash on the chest and belly and in the groin area. And we know that Kawasaki can be treated in an intensive care unit with IVIG. Because of this, and because these two types of syndromes and diseases are very similar, we know that when a child is having these symptoms of the very high fever with the multi-system involvement that we just discussed, these children may need to be seen in an intensive care unit, and they may need to receive this intravenous immune globulin to protect the heart. So basically, at this point, the most important thing for a parent to realize is that when a child is having a fever, they need to be checked by the pediatrician. And if they are having a fever and very sick looking, they need to be seen immediately in an emergency room because of this small, very rare possibility of pediatric inflammatory multisystem syndrome. The simple answer of it is that as of today, Wednesday, May 13th, we do not have an answer about what's going to be for the summer. In terms of families being able to combine with each other and mix it up and everyone living together under one roof, as of now, the rules of social distancing have not changed. So specifically for children, any child that's going to be outside amongst other children or in the area of other children needs to be wearing a face mask if they are above the age of 2. However, if it's just amongst the immediate family who they've been with for the last 8 weeks, and they're just going to be in the backyard or in the immediate vicinity of the house on the porch, of course, a face mask does not need to be worn. It is actually encouraged to be outside on the porch, in the backyard, playing on a scooter, riding up and down the driveway. Please, we need these children to get outside. It's so important that these kids get outside for the vitamin D, for the exercise, just to keep moving, to help with weight loss. It's very, very important that these children get outside. However, we are not allowing play dates, and if the child is going to be outside amongst other people, if they are above the age of 2, they should be wearing a face mask. Now, this means that they are actually allowed to go outside amongst other people, and if they're going to a park that's open, it's okay, but they should be wearing a face mask. It can be a cloth face mask, it can be a Superman or a Barbie face mask, whatever suits them best. Above the age of 2, they should have at least a cloth face mask, and adults as well need to be wearing at least a cloth face mask if they're going to be outside, going to a supermarket, going to a bake, any possibility of close interaction less than 6 feet. Every individual above the age of 2 needs to be wearing a face mask. Thank you. Have a wonderful day.